Hi, I'm Kelly Hill. I'm the Program Director at MidMichigan Medical Center Family Medicine Residency.
I think probably one of the biggest things that makes this program unique is that we are very dedicated to innovation. Innovation is kind of our lifeblood and has been for probably the last 15, 20 years. We pride ourselves a great deal on taking care of not only the individual, but the entire population.
The fact that it's a smaller town and that we're able to really engage with the people who live here makes you feel like you're contributing to something greater than just learning how to be a physician. It really feels like you're contributing to the community wellness. We know our community well. We want to know our patients well so that we can connect them with the resources that they need. And we're very lucky here in Midland that we do have an excess of wonderful resources to connect our patients to.
We recognize that taking care of a person means understanding everything about their environment, everything about their social circumstances, and everything about how they live.
Our clinic here is phenomenal. I've never seen a clinic like it before. In a lot of ways, we're kind of spoiled with the stuff that we have upstairs. Between having care managers upstairs, having social work upstairs, I don't think there's a better place to be, at least in training practice, when you have those kind of resources, at least to, really look at a patient's health, their underlying social determinants. We're set up very nicely here.
Within our residency, we are known for physicians who have good skills at talking with patients and being able to support them. In a stable community, a reputation becomes important. It also helps them when rapport is good with patients to encourage them to do the things that make them better and happier in life.
I came to Midland in the same spot that you are as an applicant, and then I came into the place and just had a feel about the people and what they were doing, and I said to my husband, this is where we're supposed to be. And I would say to you that I'm still here because of the people that I work with, and that medicine is a difficult job and family medicine is a challenging job, but we are all passionate about that. We feel like we teach that well, and we have the right people here.
I think what's important is to know that you have your own voice here and that it's welcomed.
When you go to a residency, honestly, you can get good family medicine training in a lot of places. It's the people you work with that are going to make the biggest difference in the world.
What makes this program unique is that this is a family. I don't come from a large family, and I couldn't be happier to have the relationships, the bonds with everyone, the friendships, and this is lifelong. I know that I'm only here for a few years, but I know that my bond is strong enough to last a lifetime.
So we just want somebody who will fit in with us. I always tell the applicants that it's important to find somewhere that you feel like you fit in, because you spend so much time here. The people at work really end up being your family for the most part.
It goes beyond the faculty and residents. It's everyone in the hospital, it's everyone in the community. This is an incredibly unique place where you will feel right at home. It's just such an incredible environment to be a part of.
When we came here to visit, we felt welcomed by the community. My wife and I actually talked about while we were driving back to Chicago that the people in this town are so nice. It's awesome.
We firmly believe that family medicine is the future of all care delivery, and we aim to train our residents in that vision.
I didn't expect everybody to be so nice and helpful here, but especially with the specialists, we do work with them closely. We do learn from the cardiologists, the surgeons, orthopedics, pediatrics, everybody. So when you're here with them, you're their resident. You're the pediatric resident. You're the OB resident. You're the surgery resident. They, as much as you want to engage, they will treat you like their own.
I would say at MidMichigan, we have such a close-knit community of specialists interacting with primary care, and it's been amazing to be able to have that direct access to them.
They recognize that we're primary care, they recognize that we're family medicine residents, but they're always willing to teach. They're kind of teaching around the thought process of why, and I think that helps make connections and makes it a lot easier to take care of people down the road too.
So us, right off the bat, day one, we are already somebody's primary care provider. So we already get the exposure from day one, how to build up a panel, how to take care of our patients, how to help them out.
We're all over the hospital, and there's no other residents really to compete with us. And that's a huge, huge, huge benefit. From an education standpoint, it's a massive leg up compared to other programs.
I really liked women's health, and I knew that I wanted it to be something of my future practice. And so being in an unopposed program allowed me to really have some of those experiences that I didn't think I would find at other places. and that has not been a disappointment at all.
They get some great hands-on experience in the sim lab that we're really lucky to have.
For the sim lab, we get access to it pretty much whenever we want to. We can practice on the mannequins. We do everything from like intubation to IV lines to central lines, as well as deliveries. Gives a good idea of how to do it on the actual patient.
Even though I think it's a very advanced practice that we have, it is still the tip of the iceberg. We have incredible visions about where we're going to go into the future.
The experiences here in Midland have prepared me for when I'm a provider outside of residency to be able to handle these conditions on my own.
Yeah, you come out of here really prepared, at least for independent practice.
If primary care and family medicine is your goal in residency, I would 100% recommend this program for sure.
So having access to the subspecialties, whether it be surgery, OB, or essentially anything else, it allows us to be well-rounded physicians.
This last year has really opened my eyes that after 3 years, I have the experience to really feel confident to go out to say, if I don't know the answer, I know how to get the answer, I know who to talk to, and I feel incredibly prepared.
Anyone that wants to do full spectrum family medicine, which literally engulfs every specialty, I highly recommend this program because you'll get the full feel and experience that you need.